Good afternoon, everyone. Welcome to today's update. I'll start, as usual, with the daily update on the COVID-19 statistics. An additional 10 positive cases were confirmed yesterday, which takes the total now in Scotland to 18,251. A total of 885 patients are currently in hospital with the virus either confirmed or suspected. That's actually an increase of 145 since yesterday, but I want to stress that the increase is all in suspected cases. The number of confirmed cases actually fell by 3, so don't be too concerned by what appears to be a big headline increase. A total of 19 people last night were in intensive care with confirmed or suspected COVID. That is 9 more than yesterday, but again, that increase is all in suspected cases. Since the 5th of March, a total of 4,061 patients who had tested positive have now been able to leave hospital, and I wish all of them well. In the past 24 hours, I'm sorry to say that 3 deaths were registered of patients confirmed through a test as having COVID, and that takes the total number of deaths in Scotland under that measurement to 2,485. Now, I know that after 4 consecutive days without any deaths being registered under that measurement, news of any deaths, while not unexpected, is also not what we want to hear. And of course, the 3 people whose deaths were registered yesterday, like everyone who has died from this virus, were individuals whose loss will be causing heartbreak to those who loved them. So I want to send my condolences again to everyone who has lost a loved one to this illness. However, and let me say, I know this will be of no comfort whatsoever to those who are grieving, but it is still worth remembering and emphasising the overall trend in Scotland's figures. On this day last week, I announced 4 deaths, which took the total for the previous 7 days under our daily measurement to 23. The 3 deaths I have announced today take that 7-day total to 9. So that is a sustained and significant ongoing reduction, and it is due to everybody. And as I will make clear later in my remarks, maintaining that progress is also a responsibility for all of us as we move forward. But I want to make clear, once again, my particular gratitude to health and care workers and indeed to all key workers. We are all grateful for the work that you have done during the crisis and indeed continue to do. Now, the media conferences for the rest of this week will cover a range of issues. We are here in St Andrew's House all week because the Scottish Parliament is not sitting this week. Tomorrow we will report on the latest weekly statistics from National Records of Scotland. On Thursday, I hope to confirm the changes that we had indicated for the 3rd of July and then for the 6th of July. And I will also talk then about advice we are due to receive on the 2-metre rule for physical distancing and whether there are any circumstances in which that can be adapted with appropriate mitigations in place. And on Friday, I am likely to look ahead to the weekend, particularly in view of the changes to travel restrictions that are likely to take effect on that day. Today, however, I want to focus on where we are now, and that's probably an appropriate time to do that, partly because of the data that we have seen and been reporting recently, but also because today marks the 100th day of lockdown, although I realise that for most of us, it probably feels a lot longer than that. But it is worth looking back and remembering where we were then and indeed how far we've come. At the time when lockdown started, COVID was starting to run out of control in Scotland. Because of that, 2 weeks after the start of lockdown in early April, hospital admissions for the virus averaged over 200 every single day. 2 weeks after that, COVID deaths in Scotland, going by the wider National Records of Scotland data, were averaging more than 90 every single day. To be in our current position, with hospital admissions averaging just 4 a day, with consistently low numbers of new COVID cases, and with such a sharp reduction in death rates, all of that is massive and it is very welcome progress. And once again, I want to thank everybody across Scotland for that. All of us have played a part in getting to this position. And I believe we now have a genuine chance to come as close as it is possible to get to eliminating this virus in Scotland. Of course, we will then have to work to make sure we keep it at those levels. And that gives us, if we get to that level and keep it at that level, that gives us the best possible chance of seeing more of our friends in less restricted circumstances, of reopening the economy much more fully, and of being able to fully reopen our schools. So this is a moment of great opportunity, but it is also a time of very real danger. And I suppose it is that I want to focus on for a couple of minutes today. Not to be negative, but to be realistic and to seek to persuade you all that we still have to work very hard to make sure that the progress we've made in recent weeks is not lost or, even worse, reversed. We all feel a sense of relief at low levels of the virus today. I know I certainly feel that relief intensely. But we saw from late March onwards just how quickly low levels of the virus can spread to become much higher, and we saw then the consequences of that. Some of the reports we're seeing from elsewhere in the UK and around the world right now underline that point. Lockdown restrictions have just been reimposed in Leicester in England as a result of increased transmission. And we're seeing increases in infection rates in other countries, some American states, for example, and in Melbourne in Australia. And lockdown restrictions are being reimposed in these places too. The World Health Organization pointed out yesterday that although many countries are now making progress in tackling COVID, including, of course, our own, the pandemic globally is actually speeding up and it is not close yet to being over. Now, I don't say any of this to depress anyone, I really don't, but I say it as a very loud reminder that the virus hasn't gone away. It is still present, which is why we are still seeing some new cases in Scotland. And it is just as infectious and just as dangerous as it ever was. And it will come back hard if we let it. The figures in Scotland we're seeing right now are a result of the decisions and the sacrifices all of us have made over the past 100 days. And the figures we will see in the future, in the second half of July, in August, as our schools prepare to reopen, and then into the autumn, the figures we will see then will be the result of the decisions we take now and in the few weeks ahead. And that's why, as I said, we are right now in a potentially very dangerous moment. We're reopening more public services and more businesses. We'll soon start travelling a bit more, and we'll also start seeing more of our family and friends, including in outdoor pubs and restaurants. That's absolutely right. It is justified by the progress that we have made. And it's important, of course, to get our economy going again. But by opening up a bit more at a time when the daily statistics are looking so positive, there is a real risk that people will let down their guard. It's a human reaction that all of us may be susceptible to. There is a danger that it will seem as though life is getting back to normal. And I want to stress that life right now can't and shouldn't get completely back to normal because the virus is still there. I don't want us to be looking back in a month's time or in 3 months' time and thinking that this week's figures, the culmination of 100 days of hard sacrifice, were as good as it got in our efforts to suppress the virus. Instead, I want us to be looking back in a month's time and then again in the autumn and thinking that this week's figures provided us with the best possible foundation for our efforts to almost eliminate the virus. Because if we can do that, if we can come as close as possible to elimination, then living a less restricted life without the constant threat of lockdown being reimposed becomes more possible. And dealing with localised outbreaks when they happen, which I'm afraid to say they will happen, will become easier. For the Scottish Government, that means that we may still have to take some really tough and unpopular decisions in the weeks ahead, and that we will have to do so against the grain, perhaps, of what many of you would like. But we will have to do that to secure the progress we've made, and if that is necessary, we won't shy away from doing it. And for all of us, it means still thinking hard in our personal lives about what we choose to do and not to do. You know, just because we can do more now doesn't necessarily mean that we should do these things as often as we used to. And it certainly doesn't mean we should do them without significantly increased care. Following the rules continues to be vital. In fact, it is even more important now as we start to interact more so that we don't squander the progress that we've made. So as we do start to go out more, as we start to go to the shops, as more people return to work, as we maybe travel a bit more from the end of this week, please remember this. The virus hasn't gone away. We have suppressed it to the levels we see today because of the action that we have collectively been taken. So we must continue to take action to keep it there and hopefully get it lower still. It is still, as a virus, highly infectious, and it is still very dangerous. And it will spread rapidly again if we give it the opportunity to do so. And that is why, and this will be the point I end on, that our public health campaign, Facts, which you have heard me talk about for some days now, is so important, because it summarises the 5 key things that all of us must remember in everything we do. Face coverings in enclosed spaces like shops and public transport. Avoid crowded places, indoors and outdoors. Clean your hands and clean hard surfaces that you touch. 2 metres distancing, that remains important and remains the advice. And self-isolate and book a test if you have any of the symptoms of COVID. By all of us remembering these 5 basic measures, we can help to keep ourselves safe, we can help to protect others, and we will save lives. So please, my appeal to you today, and I cannot stress this enough, my appeal to you is do not drop your guard at this pivotal moment. Do not become complacent. Do not drift back to life exactly as normal. Don't think that the risk of this virus has gone away, because it hasn't. Please make sure you're doing everything you can every single day, every time you go out, to deny the virus the chance to spread. And if we all behave in that way, then the progress we are seeing now on a much more optimistic note will continue. So my thanks for everything you've done over these past 100 days. And I ask all of you to stick with the advice that we know is so important. I'm going to hand over now to the Health Secretary to say a few words, and then the Chief Nursing Officer will say a word or two, and we'll move, as usual, to questions. Jeane.
Thank you very much. First Minister, last week I announced some changes to allow visiting to care homes to resume safely. Today I'm pleased to be able to confirm that we can now allow visiting to non-COVID areas in hospitals to resume safely and on a phased basis from July the 13th. From that date, patients in non-COVID-19 areas will be able to have a visit from one named visitor, with visits agreed in advance through the ward that they are visiting. This is, of course, in addition to essential visits, which have already been allowed during the pandemic. Those visits at end of life, to accompany children, to a health care appointment, to support women during childbirth, and for people with mental health issues, including dementia, autism, or learning disabilities, where not having a visitor will cause stress and distress. For patients in COVID-19 wards, only essential visits will continue to be allowed. Now, as a visitor to a patient in a non-COVID ward, there are 5 things that we need you to do. We need you to wear face coverings all through the visit. We need you to practice good hygiene as you enter the hospital, as you enter the ward area, as you leave the ward area, and of course, as always, when you get home. We need you to understand that physical distancing will still be maintained and remains important, even if you're visiting a loved one from the same household as yourself. We need you, of course, not to visit if you have any COVID symptoms at all. And in that situation, you should be contacting NHS 24, isolating and booking a test. And finally, we need you to, as a designated visitor, to give us your contact details. This is normal in the current circumstances and will assist our NHS test, trace and protect colleagues should they need to contact you. As I've said, visits will be made by pre-arranged appointments with the ward that you are visiting, and that's to make sure that we have only the right number of people in the clinical area at any one time, so we can maintain that safe physical distance. And please don't bring in food parcels or flowers or balloons or similar items when you're visiting. I need to again emphasise that COVID areas in hospitals will remain restricted to essential visitors only. I know how difficult it has been for people being unable to visit loved ones in hospital during the pandemic. It is one of the many sacrifices that you have made, And I want to thank you again for all of that and for everything you've done to keep people safe. Visiting is important. It has important benefits for the patient's health and well-being. And I hope that families across Scotland who have loved ones in hospital right now will welcome this announcement.
Many thanks. Jeane, I'll hand over now to Chief Nursing Officer.
First Minister, thank you. And as the First Minister has outlined the huge progress that we've made as a country, but we're still in a state of where we need to be sure and confident that we're following the rules. The Cabinet Secretary has just announced increase in visiting in our hospitals, building on what we have done with care homes. And I want to say a few words of reassurance to people that as we remobilise our NHS, then we are taking additional steps, the way all of us are taking additional steps to maintain safety within our National Health Service in terms of the way we're going to be delivering care. And you will see things different when and you visit a hospital either as an outpatient, as a hospital visitor, than you did pre-lockdown. Hospitals are preparing, they're continuing to deliver care safely, and what we are asking people to do is remember that this is not about getting back to normal. What we've done over the last 100 days is learn how to live with the virus as safely as we possibly can. And the way to protect ourselves and our loved ones and stay safe and save lives is to continue to follow these rules. The virus is not, it's not like a thunderstorm where you take shelter and then you look out and the rain's no longer there and you can go out. So the easing of restrictions is not about it's safe to go out. It's about we've minimised the number of infections we have. And I think, as importantly, we've learned how to stay safe. So physical distancing, wearing face coverings, and that's what we're going to be seeing within our hospitals. There will be additional cleaning taking place of the frequently used areas. We'll be asking you when you're entering the hospital to use hand gel, to remember not to touch surfaces and to wear a facial covering. Our clinical staff have been wearing the PPE that they've needed to keep them safe and others safe when they've been caring for patients. And that, the Cabinet Secretary announced last week, will be extended and is being extended to other staff who aren't providing direct clinical care, but who are in and around our hospitals, will also be wearing face masks to keep them safe, but also to stop them transmitting any infection should they be infectious. We'll be very, very careful to keep our COVID patients separate from our non-COVID patients, and also taking additional measures to make sure our staff who are caring for our COVID patients, as far as reasonably possible, stay within that group of patients. So as we're moving forwards, it's going to be incredibly important that the lessons we have learned over the last 100 days continue to be with us. And that is about respecting physical distancing, the 2 metres. You ought to see staff within our health system stay 2 metres away from each other as far as possible. Clearly not when delivering care and not when examining you if you're going in as an outpatient. But things will be different for some significant length of time now within our NHS and also in our social care system. And what we're asking you to do is to play your part in maintaining that and supporting the way that we're delivering our NHS in a different way, whether it's by remote consultation, wearing your facial covering, understanding that staff also have to wear PPE, and it may take slightly longer for that consultation. And if we all do that, then we can enjoy the benefits of that increased access to our NHS, whether it's as a visitor or accessing for elective treatment, because as we have always said, people with emergency needs need to access our health service at all times as well. Thank you.
Thank you, Fiona. Go to questions now. Firstly, Glenn Campbell from BBC Scotland.
First Minister, I wonder if the Leicester lockdown reassures you that the UK government is committed to tackling coronavirus. Have you reached any agreement with UK ministers on air bridges? And what is your response to the UK government statement yesterday saying that you had used disappointing and divisive language and were undermining the joint effort to tackle coronavirus?
Okay, a number of questions in there. Well done for getting 4 in one go. Let me take them one by one. Well, firstly, can I perhaps deal with the quickest one first. We're still considering the position with air bridges. We were provided with some data that underpinned the UK government's decision making yesterday. We're considering that, and we'll make an announcement on our position on that in due course, and hopefully reasonably soon. On Leicester, obviously, I understand that the position in Leicester is not what anybody would have wanted it to be, but we are likely to see localised flare-ups and outbreaks, and we have to be ready to deal with them. And I welcome the fact that action has been taken there to try to contain that. I'm sure the UK government would say similar to what I'm about to say. I think we will have to wait perhaps even 2 to 3 weeks before we get a proper sense of whether what has been done to try to contain the outbreak in Leicester was done early enough and whether it is sufficient. I certainly hope that that is the case, but not just the UK government. I think all of the governments across the UK will want to look at the experience in Leicester and try to learn from that, because we will all find ourselves in these positions, I'm sure, in the weeks and months to come. What I would say is I don't want us, if we can at all avoid it, to get into a cycle of local lockdowns, because, while some people may say that's preferable to a national lockdown and none of us want to go back there, it's not ideal for local areas, and it's not ideal for any of us to be living under this threat of lockdowns being imposed even on a local basis. And that brings me back to my point. The further we can suppress, hopefully to the point of elimination now, the virus, then the more able we will be to keep localised outbreaks or clusters associated with particular facilities under control in a much more targeted and less restrictive way. So that's another reason for us to all have an incentive to try to keep doing the right things to continue to drive down rates of infection now. In terms of the announcement from Boris Johnson this morning, look, I hope what the Prime Minister has announced today is the start of a conversation about fiscal stimulus and not the end of that conversation. To put it mildly, I'm extremely underwhelmed by what has been announced this morning. We can often judge the scale of fiscal announcements from the UK government by what we expect then to see in consequentials to devolved administrations. And I hope I'm wrong about what I'm about to say, but our expectation is there will be no additional consequentials from the Prime Minister's announcement this morning for Scotland or the other devolved administrations. We may see a reprofiling of consequentials we were already expecting, but we are certainly not expecting any significant additional consequentials, and that tells its own story. What that says is that this is not new money. This is simply shuffling around money that was already in the system. And I don't think that is commensurate with the scale of the challenge that we face. The Prime Minister has taken over the last few days to comparing himself or allowing himself to be compared with FDR, Franklin D. Roosevelt. And this has been described as a New Deal. The New Deal under FDR was worth, I think, around 40% of US GDP at the time. What Germany has announced right now in terms of its stimulus is worth 4% of German GDP. What the Prime Minister announced this morning, and it's not even new money, would be less than 0.5% of UK GDP. It's simply not of a scale that is required. So I hope we can have a discussion based on the proposals that the Scottish Government published yesterday that will be much more up to the scale of the challenge that we all face. And the Scottish Government wants to be a constructive partner in those discussions, and we will also take very seriously our responsibility to maximise our own resources and levers to help with the challenge that lies ahead. And I think your last question was about an accusation that I had been somehow divisive in language I used. And I want to just come back to basics here. We're not dealing with politics at the moment with this virus. We're dealing with a virus that we know poses a real risk to health and to life. We know it's a virus that doesn't respect borders or boundaries, and we know that we have to focus on trying to stopping its spread. That's why the action that has been taken in Leicester has been taken to try to stop the virus sort of breaching the boundaries of Leicester and spreading more widely within England. And that's got to be our focus. So I think as we decide in Scotland how we tackle this virus on an ongoing basis and how we try to avoid spread within Scotland, but also avoid cases coming into Scotland, frankly, anybody who is trotting out political or constitutional arguments is in the wrong place completely and has found themselves completely lost. This is just about what we need to do from a public health, practical perspective to stop a virus spreading. And on that front, everything's got to be an option worth considering. So I've tried all along, when it comes to containing this virus and stopping its spread, to come at it in that way and not politically. And that's how I'm going to carry on. And, I hear people talking about things I said about considering how we stop the virus coming from other parts of the UK into Scotland, just as we would have to think about how we stopped it spreading from Glasgow to the Highlands, or how England's trying to stop it spreading right now from Leicester to other parts of England. I saw comments yesterday that sounded as if we were dealing with something that was a constitutional argument. That's nonsense, and we cannot see it like that, or we're letting down the people that we're here to serve. I think I answered all your questions there, Glenn, but if I missed any, I'm sure you will let me know.
One extra.
Did I? Oh, right, sorry. You always get a bit extra. Gordon Cree from STV.
Thank you. I'll try and keep this to one or two questions then. You said that tough and unpopular decisions may need to be taken in weeks ahead to secure progress. Do you have anything particular in mind? And when you say about the need to guard against complacency, are there any particular behaviours you're seeing, hearing about, or being made aware of that have concerned or frustrated you?
So these are good questions. And on the first one, I'm not citing anything in particular right now. I am just making the point that as we go through the next few weeks and months, both in order to protect the progress, because I don't think anybody out there across Scotland wants to see us squander the progress that has been so hard won over the past 100 days. So both to avoid us losing that progress, but also to deal with any risks that arise and any flare-ups in transmission, we will continue potentially to have to take difficult decisions, and they may take the form of not easing things up as quickly as people want. And I'm not referring to this, but I mentioned in relation to Glenn's, one of Glenn's questions, we're still considering very carefully the issue of air bridges, because it's not straightforward. We have to be very careful. Even if people do fancy the idea of going on holiday, we've got to be very careful about the risks of bringing cases or allowing cases to come into Scotland. So there will be instances where we maybe can't ease up as quickly as people would like. And there may be, and I hope we can avoid this, instances where we have to go backwards a bit and reimpose a restriction because we think the virus is getting out of control. And this is not a position I guess any politician likes to be in, but it is one that's so important right now. Politicians should not see this, and I am determined not to see it as some kind of popularity contest. If ever there was a time for politicians to try to do the right thing, whether it was popular or not, then this is that time, and that's what I'm going to try to do, and the Scottish Government is going to try to do as well. Second question, there's no particular behaviour that I'm seeing that is concerning me. I spoke a few weeks ago about being concerned at people gathering in crowded places. I would be concerned if I saw that. I suppose what I'm reflecting right now is two related things. As we do start to ease carefully these restrictions, some of life will feel as if it is going back to normal. I'm sure a lot of people yesterday, for the first time in 3 months, were able to go shopping, and it just feels, I guess, that life has gone back to normal a little bit. Now, that's okay up to a point, but we shouldn't be allowing things to go completely back to normal in terms of how we're doing things like that, because we have to be on our guard. And that's the second related point, and I include myself in this. We've all been through such a bizarre, unusual, difficult period in the last 3 months that we're all anxious just to live a bit more normally. And that's not just about going out to places we've not been able to go to, but not having to worry about things like constantly washing your hands or wearing a face covering. The point I'm making is that actually all of these things that have been important up until now are more important. You know, if you've been in your house all the time in the last 3 months, then I hope you've been washing your hands, but the risk of you transmitting the virus to others has been reduced because you've been in your house. As we go out more and meet more people, if we're not washing our hands, if we're not wearing a face covering, the risks we are then posing to other people are much, much higher. So a time when the instinct will be to lower our guard is actually the time where we need to increase it further. And I just want people to hopefully understand that, and I feel a real duty and responsibility to constantly get these messages across. I want to be optimistic about the progress we've made as much as anybody else does, but I don't want us to squander that progress, and I know how easy it would be. If we think, compare now to early part of March, the positions actually are not that different in terms of the levels of the virus. And we saw in March how quickly it took off. So where we are now compared to April is much, much better. But if you compare it to the very start, you're reminded at how quickly it could take off again. So don't let that happen. And that is my appeal to everybody. Peter McMahon from ITV Border.
First Minister, thank you very much. First Minister, today in his speech, Boris Johnson committed to dualling the A1 in the remaining parts in England to the Scottish border. Would you commit to do the same in Scotland? Because, as you know, there's a large chunk of the A1 is still not dualled, and people think that it should be. And secondly, if I may, reflecting on the 100 days as you have, there's quite a lot of evidence that the earlier countries locked down, the fewer lives were lost. Do you wish now that, looking back, you'd introduced lockdown a bit earlier and saved more lives potentially?
On the first part of your question, I recognise the importance of that and making sure that we have action both sides of the border. I would simply just repeat my scepticism about the substance of some of what the Prime Minister announced today and how much of that actually adds up to additional hard cash that will allow us to do additional things. So we'll scrutinise that a bit more carefully before getting to the position where we think we can make specific commitments with money that may not even exist. It's a good question, Peter, and I try not to spend too much time looking back because I've got to focus on looking forward. But I think you can take it as read that all of the decisions that I've had to take, that we've taken, all of the experience that we've been through weighs heavily on me, and I think always will weigh heavily on me. But there's not a lot of point right now in me wishing that we'd done certain things differently. We took decisions based on the best evidence and judgment we had at the time. I'm sure when we do come to have a proper systematic look back at that, we will find that we got some things wrong, and I'm not saying that will be one of them. And we will also find that there are some things that had we known then what we know now, we would have done differently. And I think it's really important, and I've said this before, that we have that long, hard look, both for reasons of accountability, but also for reasons of learning lessons. But right now, I've got to keep focused on the path ahead and making sure we stay on the right path. And I suppose the last thing I would say is this: if anybody out there does think, and it's a perfectly legitimate point of view, that if we could wind the clock back, we would have gone into lockdown a couple of weeks earlier, what I would say to you is that we can't wind the clock back, but we can avoid winding it forward too quickly. So I don't have the benefit of hindsight right now, but I do have the benefit of foresight. So let's not come out of lockdown too quickly and at a pace that puts our progress in jeopardy. We are following a path that I think is the right one. I know it's frustrating and people want it to go quicker, but at the end of the day, if the reward for going a bit more slowly is getting to where we want to be more sustainably, then I think that is worth doing. And it's probably no surprise to anybody that one of my favourite stories when I was a child was the tortoise and the hare. So people can perhaps read into that what they want. Fraser Knight from Global.
First Minister, this morning we've heard some concerns that social distancing on ferries could mean a significant reduction in the number of tourists who are getting to our island communities, which rely so heavily on tourism for their local economies. Some businesses in Arran have said that they don't think it would even be worth opening because the visitor numbers could reduce from 4,000 per day to just 400. I was just wondering if you could explain to us why social distancing is needed on ferries when planes are able to take off with passengers who, from complete strangers, are sitting right next to each other. And as more people look for staycations this summer, will more be done to help get tourists to these remote parts of the country that rely on them?
So, Fraser, forgive me, I'm not going to say too much about physical distancing right now because, as I indicated earlier on, I will say a lot more about that on Thursday when we've had the advice from the advisory group. And I absolutely recognise the tension that is in play here, not just for ferries, but for restaurants and pubs and other parts of the hospitality industry in particular, and the balance we need to try to strike. But we do need to try to get that balance right. Moving away from 2 metres, and I'll say more about this on Thursday, is not risk-free. It increases the risk of transmission. So we need to then work out, if we are going to contemplate that in particular circumstances, how do we mitigate that risk? Now, part of what we do to mitigate that risk is get infection rates low, which is what we are doing right now, because if your risk of transmission is increasing, if that can be mitigated because your risk of coming up against somebody with the virus is reducing, then that is part of how we mitigate that. But other things would have to be done. So we've got to think about this carefully. I understand the desire for the rural and island parts of our country in particular to see an influx of tourists, and we all want to see our tourist industry thrive again as quickly as possible. But we don't achieve that in the long term if, in trying to get more tourists into these areas, what we are actually inadvertently doing is allowing more virus to get into these areas. That would set all of us back. So these are not easy judgments and balances, but it's important that we try to reach the right conclusions on them. And as I say, I'll say more about that on Thursday. Now, forgive me, did you ask a second part of the question?
It was just to ask if more will be done to help.
Oh, and staycations. Look, we need to get the balance of this right. I always want people to visit Scotland. We've got a beautiful country. Tourism is so important. So in normal times, I would be saying to everybody all over the world, come to Scotland. But we need to get the balance between that and continuing to suppress this virus right. What I can say, perhaps most unequivocally, is people who live in Scotland, if you have the ability, if you have the financial wherewithal, and if you have the time to go on a holiday over the summer, once the travel restrictions are lifted, as I hope they will be at the end of this week, then have a staycation in Scotland. Follow all the rules as you do and keep safe and protect others. But support for people in Scotland, if you can, then find a way of supporting the tourist industry over the summer. Neil Pooran from PA.
Thanks, First Minister. The Scottish Retail Consortium has said it's concerned about flashpoints, as they put it, of staff being abused by customers. If the rules do change later this week and you decide to make face coverings in shops mandatory, how can staff be better protected from these kinds of incidents, and how can they be helped to enforce the rules in shops?
Well, it's not for staff in shops, just as it's not for the staff on public transport to be the enforcers of these rules. We have an enforcement regime, which would be the case for retail if we go down this track. And again, I'll say more about that on Thursday. But let me be very clear that nobody should be abusing or being intolerant to or showing a disrespect to people working in our shops. Remember right now that as we open up, I want people to support the retail sector. I want people to shop responsibly, following all the rules. But all of us have a choice about whether we go to a shop right now. We have a choice as individuals, as customers, whether we take that risk. People who work in shops don't have that choice. And they're there, and anything they're asking you to do, whether it is wash your hands when you come in, queue, physically distance, quarantine things you've touched, or wear a face covering, if they're asking you to do anything that you're not used to doing as a shopper, they're asking you to do it for your protection and for the protection of other shoppers. So it's just not acceptable that people would abuse or show disrespect to staff in shops or anywhere else. So please don't do it. That's the case at all times, but particularly right now, let's remember to treat each other with proper respect, and that would be a strong message I send to everyone. Simon Johnson from The Telegraph.
Hi, First Minister. The ONS reported this morning that the number of excess deaths in England and Wales has fallen below the 5-year average for the first time since lockdown started. I just wondered what evidence you had for your concern yesterday that the UK government isn't following an elimination strategy in England.
They've never said it, so if they want to say it, I'd be happy to be reassured. I think you've got the ONS stats on excess deaths are very positive news. We will see the National Records of Scotland figures tomorrow, which will also show excess deaths, and we've seen excess deaths in Scotland decline. I think it's important that you don't confuse excess deaths entirely with COVID deaths. So we are seeing, so basically the overall number of excess deaths is a sort of, a combination of all of the different reasons for people dying. We are still seeing higher levels of COVID deaths in England than we are in Scotland, but hopefully we'll see that decline as well. I was just earlier on this morning having a discussion with the Chief Medical Officer about some of these things, and one of the things, and I don't know whether it is behind English figures or whether it would be a factor in figures in Scotland that we see tomorrow, but he was making the point to me that particularly with the death of people from COVID, where they've died when they've been very old, then people may have died reasonably imminently without COVID, but have died a bit earlier because of COVID, unfortunately. So these things will also have an impact on excess deaths. But it's good news, and I hope we will continue to see excess deaths in Scotland decline as well. Tom Martin from the Express.
Hi, thank you, First Minister, and good afternoon. Just returning to tourism, following your comments yesterday related to the possibility of a quarantine policy, the Scottish Tourism Alliance this morning has said they've already been contacted by people south of the border who are concerned about the potential of this and asking about reassurances around full refunds. Obviously, you say there are no plans for this, but isn't the danger now that people are deterred from making bookings and coming here on the back of this?
There are no plans for this right now, but I wouldn't be being honest with people standing here right now or being straight with people or doing my job properly if, given the unpredictability of a virus, I was to say we're categorically ruling anything out. I'll come back to the point I made earlier on. This is about trying to keep a virus under control. And I know the concerns the Scottish Tourism Alliance would have about a policy like that. I understand that, and we would consider anything like that very carefully. But I know the STA would also be concerned, and I'm sure should be concerned about the prospects of having an increase in cases of the virus in some of our beautiful tourist spots. So this is a balance that we have to try and strike. It's not ideal. None of us want to be in this position, but continuing to keep this virus under control has to be the driving imperative here, because if we take our eye off that and it runs out of control again, then we won't be talking about our tourist industry recovering, because we'll all be back to square one. And so I know I start to sound as if I'm repeating all these messages time and again, but you're going to hear them a lot more, because this period ahead is a moment of opportunity, as I said, but it is also potentially a moment of real danger for us if we just forget about the risks and rush back to normal in every respect. Michael Blackley from the Daily Mail.
Thank you, First Minister. Just to pick up on that previous question about the Scottish Tourism Alliance, they do point out that 70% of Scottish tourism is from the UK market, and they raise concerns that any restrictions would have a significant impact. Can you just clarify then for those in other parts of the UK that might be thinking of booking a holiday here from the middle of next month onwards, are they welcome to do that from the 15th of July?
Look, people in England are welcome in Scotland. That's always been the case and always will be the case. But I cannot ever guarantee, just as the UK government cannot guarantee right now that people in Leicester might not be restricted from travelling to other parts of England, I cannot guarantee that we will have no need to impose any kind of restrictions to keep this virus under control. And anybody who thinks I should do that right now is coming at this from completely the wrong perspective. I will never take any decisions associated with this virus lightly, but I will take the decisions that are necessary to protect the Scottish population. And I know that will, whatever I say here today, translate in a certain form onto the front page of the Daily Mail. But as I said before, I've got to not perhaps be driven by those considerations and just continue to be driven by what's necessary to protect the health of the country, because it's by protecting the health of the country that I do most to protect the health of the economy and give it the best possible chance of recovering in a sustainable way. Tom Peterkin from the P&J.
Good afternoon, First Minister. Derek Provan, the Chief Executive of Aberdeen and Glasgow Airports, has said that air bridges will strike a balance between protecting public health and getting the country and the economy moving again. And he says that blanket quarantine has been hugely damaging to the economy. Now, I realise that you've said that this is something you're still looking at, but can you offer him any comfort or reassurance that there will be some form of air bridges to Scotland?
I'm not going to announce a decision before I've taken the decision. And, you know, as First Minister, as the Scottish Government, it is our duty to see these issues in the round, to absolutely take account of the economic impact, but balance that against the health impact, because these things ultimately, they feel as if they're in conflict, but ultimately they're not. They're two sides of the same coin. And I would expect those in the aviation sector to argue for as much freedom in air travel as possible. And I would expect those in the health side of things to argue for as much caution around these things as possible. The job of government is to take all of these things into account and come to the right balanced decisions for the good of the country, and that's what we will do. I'll actually be speaking to Derek Provan and other members of the aviation sector later on this afternoon, so I'm sure we will have a fulsome discussion around these issues then. Vivian Aitken from The Record.
Good afternoon, First Minister. I know I raised this last week, but I just wondered if the Scottish Secretary for Health could tell us this morning when the Louisa Jordan is going to be brought into action to clear up some of the backlog.
So I said last week that we were currently, as part of the NHS remobilisation plans, we were looking at options to use NHS Louisa Jordan for outpatient diagnostic and possibly some elective work. We've not reached a final decision in that yet. Of course, all of that remobilisation work is set in the context where our NHS does need to retain capacity to deal with any increase in COVID cases. As soon as we've made the decision on the Louisa Jordan, of course, we will let people know.
Sienna?
And what's going to be important for people to pick up, whether it's outpatient treatments or inpatient surgery, is that their personal needs are taken into account as well. So local service for people where they can access that with clinicians that they know is incredibly helpful. But we've also seen examples of where waiting list initiatives and people can take forward a clinic in a more remote area, and what local boards will do is do whatever they can to protect the needs of their population and provide as easy access and as good access as possible, and that would obviously take into account whatever the Cabinet Secretary determines on the Louisa Jordan.
Kieran Andrews from The Times.
Thanks very much, First Minister. You talked earlier about, I think you said you were reluctant to lock down full cities as part of more localised approaches. Obviously, we've seen what's happening in Leicester and a bit of confusion about exactly where the boundaries are. In an interview with Hollywood magazine that's published today, you talked about locking down parts of Glasgow. I just wondered how that would work in practical terms, and you know, how you would get information out to people so that the exact areas being locked down would know they had to lock down, how that would be enforced.
I know this is an unfair thing to say to you, so my apologies for this in advance, but don't read too much into what I said today, the particular phraseology I used, nor should you read too much into that phraseology in the Hollywood magazine. I'm just trying to make, I'm illustrating points. This is not, and don't think we've taken a decision. We wouldn't lock down a whole city if that was required. We would go for parts of the city. We will do what is required. The point I'm making is that the more we can drive the virus to very low, close to elimination levels right now, and the more we can use our testing infrastructure, test and protect infrastructure, and our surveillance mechanisms to catch outbreaks early or to catch community transmission early, the more targeted and narrow-based we can be in the suppression measures we use. And that should be what we are aiming for, so that we are, as far as possible, trying to avoid the necessity of locking anybody down again, and if we were in that position, of locking down huge swathes of the country. But I come back to the point, we'll do what is necessary to protect people from this virus. But if we carry on with the strategy we're following just now, we hopefully will be in a position of being able to be much more targeted and much more narrowly based in how we deal with any probably inevitable flare-ups as they happen. I hope that makes some sense. Scott McNabb from the Scotsman.
Thank you, First Minister. Can I just go back to the other comments where you talk about Scotland being in a dangerous moment, and you spent quite a bit of your opening remarks urging against complacency as the economy starts to reopen. Is there anything in the recent data you've been seeing that's maybe not been made public, which suggests to you and gives you concern that people are growing a little bit more complacent in their everyday behaviour?
There's nothing yet in the data that I am seeing that would concern me at this stage. On the contrary, everything I'm seeing from the data says we are heading in the right direction. But remember, and this will be something you've heard us say often before, that there is a time lag in this. So if we all start to throw caution to the wind right now and stop following the rules and just go back to normal, it will be 2, 3, 4 weeks before we see the impact of that in the numbers that we are reporting on a daily basis. That's the first point. The second point is it's definitely not anything I'm seeing in the data right now that is leading me to give these warnings. It's just because I understand that it is human nature, that we've lived under lockdown for 3 months. There is a sense of things starting to go back to normal a little bit. So human nature is that we almost subconsciously accelerate that process, and we just stop doing the things that we've been told to do and advised to do because, well, things are back to normal. I thought Chief Nursing Officer actually made a really good point earlier on, and it's a sort of analogy that I think is good, that it's not a thunderstorm. You know, you shelter from a thunderstorm, and when it's over, and you go back out and it's fine. It's not like this. Because we've suppressed the virus, it doesn't mean it's not there. It's still lurking out there. And if we go out and if we come too close to each other, if we don't wash our hands, if we touch surfaces that others have touched, if we don't wear face coverings, then we're giving it the opportunity to jump between people and jump between different households. And that's why we've got to stay complacent. And all of that, and this is, I suppose, the key point for people to remember, all of that is not less important now. All of that is more important as we go out more. Then the need to stop it spreading is actually more important than it was when we were all staying in our houses, because that's then how we were stopping it spreading. So I just want people not to forget that, because if we forget that and start to do things that allow it to spread, then before we know where we are, it will have run out of control again and we'll be back to where we started, and none of us want to be there. Christine Lavelle from The Sun.
Thank you, First Minister. School cleaners, janitors and sports staff have signed an open letter from the GMB to you today saying that they feel forgotten and as though their safety is at risk because they've only been given the bare minimum in PPE. How would you respond to them, and how do you plan to address these concerns?
We will respond in full. I had a meeting just yesterday with the STUC with a number of unions involved in that, and we'll respond in full to the letter. But if I take PPE, obviously local authorities are responsible for the provision of PPE in education, but there is specific guidance for use of PPE within education settings, and local authority guidance on use of PPE will also be followed as we take the decisions to open up schools, and we'll continue to work through the Education Recovery Group on all of these issues to make sure everybody in schools, whether they are pupils, teachers, parents or support staff in school, have the assurance that they need. We've also got guidance that is very clear about the responsibility on schools and councils to undertake appropriate risk assessments for staff, and we would again be expecting local authorities to follow that guidance. So these are issues everybody, we have probably this in parallel. What I've been talking about right now is we go about our everyday lives, the risk that we all start to drop our guard, coupled with what almost is an equally understandable opposite phenomenon where people going back to work have high anxieties about being in environments that they haven't been in for a while. So we need to all keep our guard up, and we need to make sure that those in particular environments, whether that's schools or other workplaces, have the assurance they need. And this will be an ongoing process, but it is one we're absolutely determined to take forward in the right way, involving discussions with the right people. I have next Tom Gordon from the Herald.
Hello, First Minister. You were saying earlier you didn't have much time for people indulging in constitutional arguments, but Boris Johnson, in his speech this morning, certainly had no such qualms. He was going on pretty hard about the union, calling it an incredible partnership and saying it had more than shown its worth in the crisis. I just wondered what you made of that. And also, briefly to the Health Secretary. 3 weeks ago, you told Parliament about 125 incidents of COVID infection in hospitals, which led to about 900 patients and the same amount of NHS staff being infected. We still don't have any kind of breakdown as to how many of those were probably acquired in the hospital rather than brought in by people. Do we have any progress on that?
Do you want to take that?
Happy to take that first. The point I would make, Tom, is that the numbers you've just quoted were suspected transmissions of COVID and therefore suspected deaths, because those figures, as I think I made clear in Parliament, are unvalidated figures. And so the work that's been going on since then is to validate the numbers, and that then does tell you which ones of those, what proportion of that overall number were COVID infection acquired in the hospital setting, as opposed to already with the patient or staff member when they entered the hospital. That work is not yet completed. It's close to being completed, and as soon as it is, then we will publish it, as I said we would.
Look, all politicians, all leaders have to choose their own language. They have to choose how they conduct themselves at all times, but particularly during a time of national crisis. Boris Johnson and I are very different kinds of people, very different personalities. I would, on a whole range of ways, choose not to emulate him and how he speaks and how he behaves. And I'm sure he would choose not to emulate me in many respects. I don't think you'll catch me very often leaping to the floor to do press-ups during a media interview, for example. So we have to make our own decisions. But in terms of the constitutional arguments, right now, my focus is on tackling this virus and doing my duty to the people of Scotland and doing that to the best of my ability. In terms of the wider and future arguments about Scotland's constitutional future, well, people will make their own minds up on that, and they will draw their own conclusions. And part of the process that they will go through, I'm sure, in coming to these conclusions, is watching how the Scottish Government conducts itself and watching how Boris Johnson's government conducts itself, and they will come to their own conclusions. But right now, my focus is on tackling this virus, because I think any leader who's doing their job properly right now would have that as absolutely their central focus, and then, of course, trying to guide the country through a sustainable recovery from it. Andrew Learmonth from The National.
Good afternoon, First Minister. You were talking earlier about being worried about people dropping their guard. The Scottish Greens have called for face masks to be made mandatory in High Street and shops. Would that be one way of mitigating against any guard dropping?
Yes, it potentially would be, and I've said previously that I will set out our decision on that on Thursday, which I will do. I want people to wear masks for the right reasons, because we think it can help reduce the risk of transmission. But as we demonstrated on public transport, if we think we need to make that mandatory in order to get sufficient people following that advice, then we will do that, and I'll confirm that. Or confirm the decision, whatever that decision is going to be on Thursday once we've completed our consideration of it. But I would say to people, don't wait for that. We're asking you to wear a face covering in shops because we think it will make a difference. It won't stop coronavirus on its own, but as we go out and the risks of transmission increase because we're interacting more, we need to do everything we can to reduce the risk, and that's physical distancing, it's washing your hands, it's washing surfaces that you touch, and it's also wearing a face covering. And if we do all of these things, then we help to reduce the risk of passing it on to somebody else or having somebody else pass it on to us. So please do it, and we'll come back and confirm the position on whether it's going to be mandatory or not in shops later this week. Thank you very much for joining us. That concludes the question. My thanks to the journalists. Thank you to Fiona and to Jeane and to Anna, our BSL interpreter for today. And thanks to you for joining us. We are making really good progress, but I will keep saying that in order to continue that progress, we've all got to continue to do the right thing. That virus is still out there. It hasn't got less infectious. It hasn't got less dangerous. So if we give it the opportunity to spread, it will take it. And therefore, the 5 things that we all need to do are face coverings, as I've just been talking about, avoiding crowded places because that's where it gets most opportunity to spread, cleaning hands, avoiding touching hard surfaces, but when we do, cleaning them, 2 metres distancing, and of course, if you have the symptoms of the virus, self-isolate and book a test. And if we all follow these 5 basic measures, then we can reduce the risk of transmission and keep making the progress that we are making. So my thanks to all of you for your cooperation on that. We'll be back here tomorrow at 12:30 when we'll have the latest National Records of Scotland report and of course the latest update on the other statistics. But in the meantime, thank you very much for joining us.